Hi, St. Phillips. It is Dr. Tamara Blackwood, and I am here to give you some information about breast cancer because October is Breast Cancer Awareness Month. Thank you all so much for this opportunity to share with you all. Hopefully, some good information that you can take back to not only your families, but your friends, your neighbors, um, and the larger community. So, breast cancer is specifically important for Black women to think about, and that's because Black women get breast cancer, interestingly, at a lower incidence, about 3% than white women, but they're actually 42% more likely to die of breast cancer than white women. So, we're actually a little bit less likely to get it, but then we're much more likely to die from it. Um, and I think that we need to explore why that is. So, breast cancer, like all other cancers, is going to be the most treatable if it is found early. So, early stage breast cancer, so when it's still in the breast, actually has about a 99% 5 year survival rate. But that's overall. If you actually break that down by race, it's 80% for Black women and 91% for white women. And then if you look at Black women under 40, they actually have higher rates of breast cancer when we compare that to white women. And then if you look actually even under the age of 35, they're twice likely to get breast cancer and die than white women. So here's how this breaks out. So one of the things that we found is that Black women are not taking action. So in a survey, about 92% of Black women found that breast health was important, but only about a quarter of them had actually discussed their breast health with their family or friends. And then only about 17% of those people had actually taken the steps to understand their risk for breast cancer. And we find that Black women are often at a more advanced stage when the breast cancer is detected. A lot of times they are more likely to have not have the access to healthcare or health insurance they need, so they have like a lower frequency um, mammograms that they have, and they also have a longer interval between mammograms. And then we find that they don't get the same high quality care when they are diagnosed. And then interestingly, they have higher odds, so they're actually 2 times more likely of getting triple negative breast cancer, which is more aggressive than other types, and it can often come back after treatment. So there's a lot of facts and figures, and all from 2019. But I think what it tells us is that we as Black women are at risk of not being diagnosed at an earlier stage, at a more preventable stage. So here are some things to think about, and that is the screening guidelines first. So in terms of what the American Cancer Society suggests, women should be screened for breast cancer starting by, they say age 45, but it can start as early as age 40. And then they should be screened every year after, so basically from age 45 to 49. And then basically should be screened thereafter from, they say, 49 to basically as long as the woman is in good health. And that will look different for different people in terms of when that age is. Once a woman gets to be 50, then it's recommended she can space the mammograms out to every 2 years. And that's both a recommendation from the U.S. Preventive Services Task Force and the American Cancer Society. So again, if you are between 45 and 54, you should be having your mammogram every year. And then once you get to that age, or like I said, some recommendations also make that at 50, then you can get a mammogram every 2 years. So some of the ages and are a little off depending on who you look at, whether you're looking at the American Cancer Society guidelines or the U.S. Preventive Services Task Force. But in general, if you are above the age of 40, you should be up to date on your mammograms. Now, listen carefully. If you have a family history of breast cancer and you know this has been an issue, then you need to reach out to your daughters, your nieces, your friends, and let them know that they can go to their primary care doctor and ask to be screened earlier. So I just had my yearly checkup, and I'm not yet 40, but my primary care doctor said, yeah, if you want to get checked earlier, you can. If you're just worried, I have a history of cancer in my family, not breast cancer, but she said, it is cancer, so it might be something you want to think about. And I was like, oh, yeah, that makes so much sense. I probably wouldn't have thought about that without her approaching me. So that's why I want to share that with all of you all, to bring that to your families. You don't need to wait until you're 40 if you feel any kind of concern at all. And then the other thing to think about, besides being very up to date on your mammograms and very up to date with your screenings, is to think about what you can do to prevent breast cancer. And so these are some lifestyle things you can think about. One of them is limiting alcohol. It's fine to have a glass of wine here or there, but just being purposeful about how much you drink. Not smoking. There is a link between smoking and breast cancer, particularly in premenopausal women. Controlling your weight. There are some studies that have shown being overweight or obese can actually increase your risk of breast cancer, particularly if your obesity occurs after menopause. So you want to think about, no matter how old you are, staying in good shape. And then that goes with the next recommendation, which is being physically active. So physical activity is a twofer. It not only helps you maintain this healthy weight that we talked about, that's going to keep you safer, but it also helps to prevent breast cancer. You may be asking me, Dr. Gail Blackwood, how much should I exercise a day or a week? And the way it's recommended for this to think about is to have at least 150 minutes a week of moderate activity, or 75 minutes of vigorous aerobic activity weekly. And how you split that up daily is going to look different, Maybe you have a couple days where you go all out, but for most of us, we could split it up every, a little bit of exercise every day, and that's going to go a long way. And then for those of you who have younger people in your life who are of childbearing age, you want to encourage them to breastfeed. So there's been some connections between breastfeeding and preventing breast cancer. So it's actually recommended that women breastfeed as long as they can. And then trying to limit the duration of hormone therapy. If you've been put on hormones for your menopausal symptoms, thinking about asking about other options, that could be important. And then, trying to avoid exposure to pollution in the environment and other toxins. There seems to be some connection between pollution and other toxins, and not just breast cancer, but cancers in general. So that's why I would recommend that. And then the last thing you can do when you're really thinking about prevention is really knowing your own body and being, very vigilant about examining yourself and making sure that you're noticing any changes or like bumps, lumps, things that weren't there. You know your body best. And so if you feel something that wasn't there before, then don't hesitate. Go to your doctor and ask for mammogram, even if it's you're in that every 2 year window. You don't need to wait for the 2 years to be up to get a mammogram. And then the last thing that I really want to talk about is being an advocate for yourself, or for a family member if you need to. We as Black women really need to speak up for ourselves, because a lot of times, as a physician, I will say, like, yeah, I know a lot, but I don't know my patients as well as they know themselves, right? No one knows your body better than you do. So if you have a concern, if you have a question, don't hesitate to speak up and to push a little if you need to, because sometimes you need to stand up for what you think is a concern or what you're worried about in order to be heard. So I really just want to emphasize being being sometimes a little more forceful than we're used to, because in the end, like I said, only you know your body in a way that no one else does. So really being strong about that. All right. Well, I wish you all the best in screening, detecting, staying healthy, and hopefully keeping breast cancer at bay.